I would invite people to turn on their video and their microphones if they have a question or a comment to make. Question for any of the presenters, Kendra, Michelle, or Eduardo, or examples of challenges and that would help to discuss here.
Yes, I have a question. And I really appreciate all the information that Eduardo provide to us, because this is the way that we can be educated to provide to the workers the information that they need right now. And I just noticed that most of the time we had a big gap between farmers and workers, because they don't get any information. They just bring them here to work and that's it. And now when the COVID start hit every farms around this area, we have more gaps. And that means that we don't know exactly how, when the workers or the farmer have an outbreak relating COVID, how they can apply for so many workers at the same time, and how they will be covered according with the cases that they have to present. It's not any information about WSIB, how they are going to cover them, how long it's going to take, and if the worker know that information, because they don't know anything. They just know that the owner of the farm is going to apply for them, but they don't know. They don't have any information about that. How we can cover that gap?
So thanks, Christina. So that's a question, I guess, about worker information and education, and worker accessible education and information about WSIB coverage. I don't know, Kendra, if you have any sense of whether there's been any progress in that regard from the board in trying to create worker accessible information and getting it out to workers in different ways.
Yes, my understanding is that there's a package that's being provided at landing by Canadian Border Services, and that was developed by the federal government. And we do have information with regard to filing a claim, as well as related to COVID-19 in that package, is my understanding. I haven't, unfortunately, been able to get my hands on the package itself, but we have provided information to be included in that package as they land with regard to that. We do, when there is an outbreak at the farm, and I can speak to this personally because I have worked with a number of farms that have had large outbreaks, we do work with the employer and give them as much information as quickly as possible in order to ensure that they understand the claims process and can pass it along to their staff. Our adjudication process has been fairly quick, as well as the payment process. We have worked with many farms who have had large outbreaks to ensure that it is seamless, efficient, and effective. And that has been part of the practice since last year with COVID-19, when there was a need that was established. And of course, if somebody does have a question with regard to a claim, we do have our customer service. They can call into customer service and somebody can speak to them in their preferred language to get more information with regard to their claim.
There are actually, go ahead.
No, I was going to say, just as a follow-up question, can I just ask Kendra a bit further? Yeah. So Kendra, from your experience, how does the worker get informed that a claim has been submitted for them in the case of an outbreak such as that?
The employer is required to provide a Form 7, a copy of the Form 7 to workers. That's consistent within our practices, that there is that requirement. We've been trying, in order to create efficiencies, we do send out documentation as well. So there is letters that are sent out to them. We do ask when a claim is filed that the employer put the preferred language. There is a box for that, to please identify that, because we will translate communication that does go out if we know what language is the preferred language. So we do make those efforts when we're sending out any of our documentation or communication, that is part of the practice that we have undertaken.
Okay, and so then the employer does a batch reporting, basically, like they don't do a Form 7 for each individual worker, do they?
No, they do. They're
Oh,
required
do
to.
they? Okay, excellent.
Yeah.
And so
Sorry.
then, is your understanding or of the employer's responsibility is that they would give a copy of that, like a paper copy, to each individual worker,
They
even
should,
though
yes.
it may not be in their language, in the worker's language. Yeah. Okay. Thanks. A lot of detail.
So there are a couple questions about Thai resources, I think. I don't know, Oratai or Mavra, either one of you wants to speak up about that. It sounds like it's a specific item that you're asking if and when it's going to be translated into Thai that hasn't been thus far.
It's already translated and put online VOS VGA website, and Thai workers have been into that and view it. And what happened was the WSIB asked Eduardo to take it down online. We just want to follow up about that, Kendra. Could you
So I was not involved in that translation process, so I'm not the right person to communicate with that on that issue. That hasn't been, and I do know, Eduardo, I think you're meeting with my colleague on that more, correct?
Yeah, I think it was just a misunderstanding in terms of, yeah, we got the slide deck for the videos in English and Spanish, but then there was a, Oratai helped us do translation, but I think there was a disconnect that, WSIB needs to kind of do their own translation in terms of their materials just to kind of, meet your organization. So it was a bit of pulling that one down, and then, yeah, but we're working on making sure that that we figure out then who's going to take the translation over and like that. So, yeah.
So right now they don't have the resource in Thai.
Yes, I believe not yet. Mm-hmm.
And Steph has asked about Tagalog as well. Has there been any translation of the COVID resources in Tagalog? Do you know, Kendra? It's the language of the Philippines.
No, the main resources have been translated in English, French, and Spanish with regard to COVID-19 at this point.
Okay, and then low literacy is another question, I guess. Is there an effort to simplify things, or I was going to wonder about videos or podcasts or verbal explanations, little like GIFs or things like that. Do you have any animation or video explainers for workers that around how to make a claim, what it means when a claim is made? Any of that? Are there videos for workers?
Any resources would be available on our website at this point, and we continue to make improvements with regard to communicating how to make a claim and everything like that. I'm not aware of any videos. Doesn't mean they don't exist. I'm just not aware of any.
Great.
When can we expect information on the worker? Lots of good questions from both employers and stakeholders on that. We unfortunately are simply the vehicle for the delivery of the program. At this point, we don't have any updated information. I would recommend continuing to watch our website. There is a link within our website that links back to the page that provides information with regard to that. But at this point, we don't have any updated information with regard to that. Debbie and I get a lot of questions around that one. Trust me, we would love to share if we had any, but.
That's the 3-day sick leave program?
Yeah, it's an Ontario government program. It's not our program.
Meanwhile, I see someone did put a question in the Q&A.
Donna Brown has her hand up as well.
Okay, Donna.
Yes, good afternoon, everyone. I have a quick question with regards to WSIB claims for, say a worker is in quarantine in the hotel, isolated, and they do end up, testing positive for COVID-19. Is the employer, and of course they're expected now to spend an extra, I think it was extra more than 14 days in quarantine. Is it the employer expected to file an WSIB claim for the additional? Okay.
They're supposed to, if anybody tests positive once they land in Canada, a Form 7 should be submitted. So if they test in quarantine and isolation, if they test at the airport, a Form 7 should be submitted.
Thanks.
Does that make sense?
Is that the question? Is that what you were looking for, Donna?
Yes, thank you very much.
No problem.
There's also Frank Mucci had put in a question about what is the role of the field workers, to wit, the claims investigator. Not sure, Frank, if you're still here. Do you mean WSIB claims investigation?
I'm
That
trying
was
to,
in the Q&A. It wasn't in the chat. It's a Q&A.
sorry, can you repeat it? Maybe I can try and make sense of it. What was it again?
It was just, what is the role of the field workers, to wit,
Workers.
the claims investigator? I think they mean WSIB field worker, not a field worker in
Yeah,
the
that's
field.
what I was thinking. Like our field staff, is it in education?
Yes,
Like
I think so.
Okay, so we do have our compliance area at the moment is providing education, and it's called pandemic response education to employers when there is an outbreak. If they haven't reported claims, we are providing education to those individuals to report claims and how to report and how can we be of assistance in reporting. So that has been a role that our compliance area has undertaken through the pandemic and has been very active.
Okay, thanks. I see Lydia had a question about being obligated to make a WSIB report despite the objections of the worker. Is there an obligation to report?
Yeah, I might be able to answer that. Hi, Lydia, it's Michelle. We went up and down this for, I have to say, years. I contacted college physicians, surgeons, nurse practitioner organization, WSIB, etc., to ask where in legislation, etc., is it required that a clinician file a WSIB claim, and it does not exist. There is no regulation specifically requiring that. One of our physicians did get direction from their insurer, actually, with the CMA or the OMA, and the instructions from their insurer was that they were to document, everything about the assessment and the visit, and also to document that the worker did not wish or did not consent to submitting a Form 8. But there are certainly other instances where it is pretty much considered mandatory, shall we say, or just considered this is the rule, and that is with ER reports, or sometimes urgent care reports, where it's very obvious that there has been an injury. And the challenge in terms of this population sometimes with ER visits is who brings them to ER, and who reports the specifics around the injury. And certainly we know of reports where sometimes employers or whoever will put pressure or deliberately report that it was not a work-related injury. But for the most part, this is reported, and in those cases, in the ER, that oftentimes Form 8 are submitted for that type of an injury. Hope that answers that.
There's a couple more questions. So Dorothy had a question about whether the education session that you're talking about for employers actually explains that the virus is mainly in the air, or at least recognizes the risks of airborne transmission and its relevance in the context of people living together.
So Debbie responded with our pandemic response team provides information about employer obligations for reporting COVID-19 claims. They are not providing education re illness itself.
But the work relatedness, the determination of work relatedness would have to consider transmission.
Yeah, so we'll look at that. If when cases are submitted, we look at the transmission, we look at all of the information
But is there anywhere on your site that where you list what you consider in terms of how do you determine what the
Yeah,
transition risk is?
we have our adjudicated advice document with regard to COVID-19.
And that's a public too?
Yeah, I
Okay.
will find it and post it in the chat.
Okay, great. Thanks. Swanee had a question about, oh yeah, that's Debbie answered with respect to the time limit for a WSIB claim after an injury, that it's generally 6 months
Yes.
unless there's mitigating circumstances, right? That you'd have to appeal that. Okay, Eliseo, thanks. So in regard to WSIB, the issue is not about workers' rights, but how these workers can exercise these rights. On the worker side, lack of understanding and knowledge of WSIB processes and options, lack of support for them to initiate and continue with the process. On employer side, attitudes and behaviors from some of them to become a barrier for workers to exercise these rights. How the Ministry of Labor protects workers from potential reprisals from employers. That's so WSIB isn't the Ministry of Labor, but that's one of the things. You're right. How do they? And does WSIB have a specific strategy and actions to protect workers in these conditions and facilitate WSIB claims to be made by workers?
So, I mean, we obviously, if somebody is trying to, I mean, this does sound like claim suppression is kind of the avenue that is being asked. Certainly, that would be the tips line that Eduardo spoke to, that if somebody isn't reporting a claim due to fear of reprisal or the attitudes or whatnot, that can be reported, and it can be reported even if there is a concern that it's occurring, if somebody witnesses it or a fraud of the system, and that would be investigated by our compliance area. From a specific strategy, I mean, that would be the compliance would be where it would be handled. Certainly the Ministry of Labor, unless a claim is existent, or is in existence, that is really difficult for us to pursue if we're not aware of an injury. What I would say is that the Ministry of Labor might be the better avenue because they do deal with prevention under their umbrella. And certainly I know that our partners in Health Safety Excellence Program are working towards ensuring that employers are well versed and understand their obligation to create that environment, and also with regard to reporting obligations. Okay,
thanks. I think, is there like a worker navigator kind of a role at all in, like you have claims adjudication, but is there any kind of worker navigator role at all in WSIB or contemplated?
That would be customer service representatives. If anybody has any questions with regard to the WSIB, the starting point would be through customer service, and they can help individuals navigate the system. Definitely, even if they have questions about filing a claim, and certainly they have access to immediate translation services. So if somebody does not speak the language, they will happily get somebody on the phone that can help them.
Okay, and so that system recognizes the language that somehow does it? If
somebody calls in and says, "I speak this language," we will get that a translator on the phone.
Okay. Donna had a question. I think you did cover it, but maybe some clarification around is a worker covered even if injured while playing soccer off the employer's property? And could you please clarify? Thanks.
No. Oops, sorry.
So in those circumstances, I mean, those would be times of leisure off the employer's property. Generally, those would be periods where they may not be covered. However, if somebody does submit, we will adjudicate the claim. Every claim is adjudicated on a case-by-case basis, looking at the specifics of the case and the circumstances surrounding it. And they will look at the policy and coverage and everything while making an entitlement decision.
Great, thank you.
Val,
yeah.
Chrissy has her hand up.
Please disregard that.
Okay, thanks.
If I could ask a question.
Yes, definitely.
Thank you.
Is that Stefan?
There we go. Yep. Hi.
Great.
And hi, Kendra. Nice to see you. And Eduardo and everyone. Yeah. I was kind of going to fish for maybe commentary from you. I think what's really interesting about what we went through the last few months is the number of workers that have been exposed to the WSIB claim process. I think it was Michelle who mentioned kind of that pie chart. Out of 1,200 workers, 25 submitted a claim. And I'm thinking we're talking closer to maybe 1,000, maybe 2,000 based on the stats you showed earlier. So I think it's like orders of magnitude more people that have gone through the process. And I guess what I was going to invite your comments on, do you feel like there's something that we can, first of all, do more people maybe can act as kind of almost like witnesses to this process, that they survived it, no one got mad at them for following it, that it worked? And is there some lessons learned that we can use to maybe use those experience to help workers and employers trust the process going forward?
That's a good question.
So from a WSIB lens, Stefan, is that what you're thinking?
Yeah.
Yeah, so definitely, I know you and I have partnered and done some sessions with employers, and definitely, I think we were even able to get some comments within that they had gone through the process and they had said that, you know, it's painless. You know, we do the best job that we can to communicate, and I know that the associations have done a great job in continuing to endorse what we can do to assist in making the system as quickly and as efficient as possible when it comes to filing claims, to decision making. I know that I do get a lot of outreach from employers to make the process seamless. And I think it's a word of mouth almost within the agricultural community. I think that really speaks volumes. And we have had a number of people just say, you know what, out of all the government agencies, because what you have to keep in mind when an outbreak occurs on a farm, we're not the only employment agent or government agency at the table. Typically, they have 4, 5, 6 agencies that are looking for information. And that can be overwhelming for everybody involved, not just the employer, but also the workers themselves, because they have public health asking questions of them, and they may have other agencies as well. So we try to facilitate it as quickly and efficiently as possible by providing information to them and helping them utilize our online tools to make it quick and easy, also providing education on how to complete the Form 7 so that the process goes smoothly. What makes it the fastest way? What information do we need to pay it, that sort of thing. So we provide them the tools as part of our process. So my recommendation is certainly that continued word of mouth and even just almost like testimonials, if you will. I think that would be fantastic if there's a way of saying, you know what, yeah, WSIB was there and we made it through. Right. And I think that a lot of associations can assist with that. That may be something that OFVGA could help with, or, you know, and then certainly I'd be happy to partner with you, Stefan, on that if there's something that we can do, as well as, you know, our consulates. Working with our consulates has been a great source as well. And just saying, you know what, it's going to be okay. And certainly that's sort of the message that we're trying to share is it's going to be okay. We're going to get through this and it's going to be quick. And we want to make sure that everybody's okay. And I can tell you, whenever I hear from an employer, some of the first words out of my mouth is, you know, we're here to help, we're going to get through this. And, you know, we try to prioritize the work. So if somebody is significantly ill in hospital on ventilator, let's get that claim registered immediately while we're on the phone. Let's do all of those activities. So we are prioritizing that work to make sure that we're taking care of those that have fallen ill with COVID-19.
Can I add something?
Thank you.
About it, Al? Yeah.
Sure, go ahead.
Okay, yeah, it's a great question, Stefan. Thanks so much for asking that. I think that there likely are quite a number of lessons to be learned. Like as I had that slide in my presentation looking at the number of accepted claims in the agriculture industry related to COVID. And so specific to that process, as Kendra went through it, and as I mentioned, is that there was very, or pardon me, Kendra, if I say something isn't quite right, but there was specific direction to the employers about what their responsibility was, and about how-to, that there was, I guess Kendra said, assistance on how to register those claims, and then very specific information about how that was going to impact their work. Sometimes it didn't, it impacted their work more than what everyone anticipated, but pretty clear direction on how that was going to impact the work on the farm. The other thing was, and you guys know this better than I do, but to the best of my understanding, that there wasn't going to be any snapback on the employers in terms of the number of claims for that industry. which is not, my understanding, which is not sort of the same financial hit, if you want to call it, or financial concern for the employer as the more, shall I say, pre-COVID regular type of WSIB claims for musculoskeletal injuries or other injuries or disease or whatever. And so I think that's important to recognize that and to also include that as potentially one of the factors that assisted with the WSIB experience related to COVID. And like this is a discussion that I have to say that I have oftentimes with workers, is that to have a discussion about what is the impact going to be for your employer around this. Like your employer pays WSIB premiums and they pay insurance. They pay insurance for a reason. If something happens, then they're covered. Then they're not in a position of being sued. And that really, it's as from a worker perspective, is that they need to look at their needs and perhaps worry less about the employer. But I'm not sure what the employer's understanding of that is. You know what I mean? There's also, I think the fear from the employer about control over the worker, that they're going to tell them that an employer, they have to provide modified work, and the employer will say there's no modified work, et cetera, et cetera. Anyway, I think it's an excellent question, and thank you for asking it.
Just to kind of build on that a little bit, Michelle. So yes, COVID-19 claims are not being put on a specific employer. It is shared across the schedule. So all claims costs related to COVID-19 claims are not being attributed to a particular employer. So if there is an outbreak at a farm, they're not going to see the claims costs associated with that. But I think that to Stefan's point, we have definitely seen that the dialogue has changed with WSIB amongst the farms because of the prevalence of the dialogue that's occurred due to COVID-19. And it's really brought forth that element of education that I'm hoping will continue. Certainly, I've entered into a number of conversations with at the end of the call when we've been doing the education piece with the employers, just saying, our relationship as we finish through this does not end here. If you have questions related to WSIB, certainly I remain open to you and available to you. So, and I have had employers that continue to ask questions as needed. So definitely, I think it's changed the dialogue, and I hope for the better as we move forward post-pandemic.
That's great.
Go ahead, Eduardo.
Yeah, just kind of touching, and I think what you're all mentioning is really important. I think that's kind of, through the experience of COVID, definitely makes sense that employers are gonna, had to have worked through these WSIB claims related to COVID-19 and all that. I do find like I'm comparing it a lot to our experience with the public health units around vaccine information. So early on, a lot of the public health units didn't really have a relationship really clearly developed with workers, right? So communication went from the public health units generally, and I don't mean to generalize, I know some public health units might be folks beyond these lines, so definitely not meaning to generalize or even critique it, but it's about, oftentimes workers end up being organized a bit as an extension of the employer. So information funnels through the employer, and a lot of agencies that are really, have information that's to the benefit of workers knowing, haven't really established clear communication channels with workers, right? Independent of the employers. And of course, it depends on the issue when it's required or not to kind of have that connectivity. But I would suggest, collaborating with some of the community groups and the community groups that have established channels directly to workers through social media, through their own local contacts. And we saw that was happening a lot with the vaccine information. So for example, a health unit developed some really good information, but didn't have a way to really get it to workers other than through employers, right? So, leveraged new relationships with community groups who did information blitzes, right? So I could really, see at some point, a benefit with WSIB really looking to develop those relationships with worker, groups in addition, and it's all about working together, but really to try to prioritize information flowing through all parties so that, you don't, you're not, barred. And I think that's important in terms of also a feeling for workers to feel respected. It's all about, also recognizing that, we can communicate, it's not going to be easy, and it has to be accessible, and the channels have to be worked on to develop them, but they're there. And I think a lot of folks have questions and things like that. So I really think, yeah, and it's kind of happening, and sorry, I'm ranting, but we're seeing the kind of similar thing across different agencies where information can stay very static on a website and even translated, but how are workers getting to that website? Is there a strategy to say, okay, we got this website, so now let's figure out how we get this website on the radar of workers, right? Sometimes if that's not happening, great resources will stay static or unknown, and kind of not much then happens, right? So
We have the same problem actually, right? So it's something we all have to consider.
yeah, but I think case studies
over
like
and over again.
Stefan mentioned would be a great way. And Michelle used to really talk about some of the cases that we've worked with WSIB claims, where both the challenges, but the ones that have worked out really well, smoothly. We used to talk to workers about that. This is kind of how this works. And I think case studies work really well. Sharing stories and things like that could be a great way. I agree.
Okay, thanks.
I'm
So
gonna have to leave. I'm so
yeah,
sorry.
Okay.
I was just going to
It's just-
say that I don't see any of the questions, and the time has gone by. So
Yeah.
thank you very
Thank
much.
you, Kendra. Thank
Thank
you
you.
Thank you
so
for having
much.
me.
Thanks all
Thank you
three
for
of
having
you.
me.
Yeah. So, and thanks to everyone who's still here. Thank you for coming, and thank you for the dialogue and the questions. And don't hesitate to contact us if you have more questions. We will be posting the presentations on the event website, and then the also the video link will be up. So people, if you know anybody who's interested in watching it still, thanks. And yeah, thanks Vani for her technical assistance. Thanks everybody. We'll see you next time.